continue to engage in these discussions and, of course, have a good afternoon. So, we continue this afternoon with a panel discussion which will focus on resourcing and creative financing, addressing the need for greater domestic and international commitments, as well as highlighting other possible and innovative financing mechanisms. To welcome our next distinguished panel of speakers, here is the outgoing manager for GiveWell, but incoming CEO of Clinton Health Access Initiative, Dr. Neil Buddy Shah. Dr. Shah, the floor is yours.
Thank you so much. I'm excited to welcome our esteemed panelists. First up, if Minister Claudine Uwera from the Ministry of Finance of Rwanda could please join us. Next, Dr. Donald Kaberuka, who's the board chair of the Global Fund and former president of the African Development Bank. And finally, Ms. Gargi Ghosh, who oversees government affairs, economic policy, advocacy, and philanthropic partnerships for the Bill and Melinda Gates Foundation. NTDs. I think there are huge reasons to be optimistic about the fight ahead. Since 2000, we've seen a huge reduction in the number of deaths from malaria.
Chris, take us away.
Yeah, okay.
It's informal, but we're trying to get it going. So that you can just sit there and immediately go, hi, my name's...
Yeah.
Just go right into your spiel.
Okay.
As soon as you...
And the teleprompter?
Yours is not on.
Okay, but everyone is on. Oh, that...
Thanks. So as I was saying, there are huge reasons to be optimistic in the global fight against malaria and NTDs. We've seen 30 to 40% reductions in deaths from malaria since 2000. The bets that we have within malaria and NTDs are some of the cheapest and most cost-effective ways to save and improve lives, from bed nets to seasonal malaria chemo prevention to deworming pills. And of course, all the energy in this room is another reflection of all the reasons for optimism. At the same time, when we think about financing the next stage in the fight against malaria and NTDs, there are some real sources of concern. I think first of all is that the countries with the highest incidence of malaria and NTDs are also amongst the most rapidly growing countries. And so we're going to need to serve 30% more people in 2030 than we did in 2020. Secondly, there's increased pressure for new commodities such as next generation bed nets, new vaccines, given the rising resistance to these parasites as well as drugs. And of course, there are a lot of competition in the global funding landscape. And by some estimates, we're going to need to double our total amount of spending on malaria and NTDs by 2030 just to maintain the same level of coverage that we have today. And so in light of all of these challenges and concerns, I think this panel is amongst the best that we could think of about how to actually overcome these in the years to come. And I'd like to start with you, Gargi, because I know that you have another appointment to run to after this. The Gates Foundation has obviously played such a pivotal role at every step in the value chain, from funding research and development of new commodities all the way to supporting multilateral bodies and policy scale up. And I'd just love to hear you talk about the balance between the role of private philanthropy, domestic financing, and multilateral funding in the fight against malaria and NTDs.
Thanks, Buddy. I think this is working. Well, first of all, thanks to the government of Rwanda for hosting this event, and most importantly for the commitment to reaching the very last mile with health. That's, I think, what this is about as we talk about the work to be done in malaria and NTDs, reaching the very last mile. And we do it because we can. We have the tools to get there, and we have to. We have to do the right thing. I would say the financing environment, as I look at it, is fairly grim. In the global context, we have for many years used our voice to make the case for development assistance, and in particular development assistance to support investments in human capital like this, which are amazing buys for every dollar, every penny spent. But the ODA landscape is tougher than I've seen it, with countries facing their own domestic constraints, new crises with food, fertilizer shortages, the war in Ukraine. These are all genuine needs, but they mustn't crowd out the commitment of countries to support solidarity in global health. We've been, as a consequence, looking at all kinds of different financing. We have been advocating for a reallocation of special drawing rights from the IMF to increase the benefit to the poorest countries. We think debt relief needs to be taken seriously. So on the international public scale, I think there are many sources of financing that are really important to advocate for loudly. We also invest ourselves in organizations like the Global Fund and also in NTDs. And I think the role of philanthropy there has, as you say, consistently been to support innovation, push the research, but also be there to get to the last mile. We're really excited this year to be starting a new philanthropic fund with SIF and ELMA focused on NTDs. We are excited about and have made a matching commitment for private sector donations to the Global Fund. And I think overall, I see philanthropy as really a complement and a true partner. We rely on the public sector to invest in health systems, education systems, development assistance, domestic resource mobilization, the private sector for research and development, drug donations in the case of NTDs. And philanthropy will do our part as well to help make sure, in particular, that our efforts are targeted so that every dollar is spent to its maximum effect. Thanks.
Thanks a lot, Gargi. And Dr. Kabaruka, turning to you, throughout the day, there have been many mentions of the Global Fund, and every time there's been a mention of the Global Fund, the replenishment has come up, often to cheers. And so I'd love for you to speak to, as the single largest funder of malaria globally, what are the challenges that you face ahead for the Global Fund replenishment, and how do you look to overcome those with the help of people in this audience?
Can you hear me? Thank you, and good afternoon. I'm sure my minister will be saying welcome to those of you in Rwanda for coming from abroad. But thank you very much for making it to our country. I hope you feel welcome and comfortable. So I have three things I wanted to say. Number one is that, why are these diseases neglected? That is the issue we have to answer. Because you cannot neglect a disease. What is neglected are the poor people who are affected by those diseases. So I think rather than call them neglected diseases, we call them diseases of the neglected people. And if we reverse that order, we quickly understand what the problem is. It's one of inequities in the world. So the best way to fund these diseases would be to deal with issues of inequities in the world, period. But that maybe is a total proposition. The Global Fund, which I chair, is the biggest funder of all malaria programs in the world. We have made a lot of progress since the year 2000. The disease burden from malaria was down by about 40%. But COVID has set us back. So the disease burden is beginning to rise. So we have a challenge of continuing the progress we have made, but also ensuring that we continue on the path of decline of this malaria incidence. Now, we're busy right now raising money for the replenishment. We're grateful to the President of the United States, who has agreed to host us in New York in September. The United States has put on the table $2 billion and put another $4 billion conditional on others also increasing their stake. Because in total, we're looking for about $18 billion. And if you adjust for the current inflation worldwide, that $18 billion is worth much less than it would have been without inflation. So it is my hope and expectation that the world will step up, A, to make sure we continue the progress, and also that we stop neglecting these people who have those diseases. Now, I say this because in this situation of COVID, we have learned three things essentially. Number one, that the science can give us the solutions. Second, that the resources are actually available. But thirdly, they are not available to all. Take the example of vaccines. Science gave us the vaccines. Money was available to buy the vaccines. Many African countries were struggling, even when we had the money, to get access to the vaccines. Because vaccines had been hoarded by countries in the north. So it was not an issue of science or an issue of resources. It was an issue of inequality in the world. And so I hope and expect that during this replenishment, we're able to raise the $18 billion. I'm very hopeful from the philanthropy, private sector, governments. But there's much more to do. Because since the year 2000 up to maybe just before COVID, the world had made a lot of progress in reducing the disease burden, whether it's HIV/AIDS, malaria, or tuberculosis. But a large part of that funding has come from outside, from philanthropy, from funds like the Global Fund, from Gavi, from PEPFAR, from international financial institutions. We must begin to worry, therefore, what will happen in the longer term when that kind of support is no longer available. Like now, many countries in the global north will be dealing with the big issues of energy security, defense expenditures, reconstruction of Ukraine, and therefore, at a time when our economies are shrinking, and when probably resources from the north will be declining, we have to do more in our own countries. We have to raise more money for health, because you can see during COVID the link between health and economy. You neglect health, you kill your economy. So we have to do more ourselves, raise more money from our domestic resources. But as our president likes to say, it's not simply about raising money, we have to spend it well. You know, in health expenditure, I think my colleague can say this more. In some countries, between 20 and 40% of the resources are wasted. And therefore, part of good spending is to ensure that whether it is procurement, drug procurement, whether it is the way we do things, that we keep the value, that we raise money from our own economies, we spend it well, and then we ensure that the sustainability of support from outside. So for the Global Fund, I'm very hopeful, and I will tell you after September whether I've succeeded or failed.
Great, thank you, Dr. Kaberuka. One of the things you just highlighted was the increasing importance and frankly the historical importance of domestic resource mobilization. And I think many of us look to Rwanda as an admirable case study, both in terms of providing healthcare and driving down the burden of disease for its constituents, but also the role of mobilization. And so, Minister Uwera, I would love to hear you speak to the lessons you learned with the government of Rwanda in domestic resource mobilization in the fight against malaria and NTDs.
Can you hear me? Yeah, thank you very much. Thank you, Moderator, Excellencies, dear participants in this session. Most welcome, and as Dr. Kaberuka mentioned, I would like to wish you a warm welcome to this session, and especially to Kigali, and I hope you've been enjoying the beauty of Kigali since you have been here. So most welcome to all of you. So coming to the question asked by moderator, I'll say maybe it's starting by the health sector in general. I say that investing in the health sector is really very key. We've seen that, and the crisis also has shown that it's very even important just to make sure that we come up with a health system that is really very resilient. So when it comes to investments toward the health sector, and especially to malaria and the neglected tropical diseases, we've been really increasing the amount going there, because when you just account from 2017 to 2021, the statistics I have right now, we really doubled the amount that goes there, which means that we really attribute a very, very high importance to those diseases. And the investments that were mobilized, both internal and externally funded, really help us just to make a difference. Because when you see the trends in terms of reductions, when it comes to incidents for malaria or case of malaria, 5 years ago, we've seen the difference. We've, for example, been able to reduce by 77% the case of malaria since 5 years ago. We had a lot of cases. And when it comes to severe malaria and the death caused by malaria, I think there was a kind of significant reduction in terms of cases, the severe cases, and the deaths as well. So when it comes to domestic financing, the government of Rwanda is really recognized the very importance of increasing even the domestic financing. We've really been mobilizing funds from both stakeholders, including the private sector as well, because we see a room and the opportunity just to call upon all the investors, including the private sector, just to contribute a lot. So when it comes to malaria and the neglected tropical disease, or NTDs, it's very difficult for me just to repeat those names. It was highlighted by my predecessors. You know, in Rwanda, we tried a number of things, including number of tools and instrument mechanisms, just to be able to reach the most or the more marginalized people through the community-based health insurance, for example, and the other insurance. The most marginalized people were able to access to those expensive health services, for example. So, and the other practices, for example, is like a distribution of bed net. When it comes to malaria, distribution of bed net to all, without, no one was excluded in that as well. So we have also this mass drug, maybe people from the Ministry of Health might correct me, the mass drug administrations that help us just to reach 99% of school-age children. So those are things that help really just to reach the most poorest people that were in the beginning not able to be covered by the health services as well. Thank you very much. Yeah.
Great. Thank you so much, Minister Uwera. So now I just ask the panelists we can exit this stage, and we'll have a video message from Niels Annen from the German government. Thanks so much, panelists.
Oh.
A very good morning to all of you in Kigali. I regret that I cannot be with you in person today, even though this summit is very important. In times when the headlines are dominated by pandemics, wars, and climate change, we must not forget the diseases that are affecting the poorest of the poor. Worldwide, the number of hungry people is growing again, and many people are sliding back into extreme poverty. The development progress of earlier years is being undone, and the achievements of many of the SDGs has been pushed beyond our grasp. We must not let that happen. Germany, too, signed the Kigali Declaration at the beginning of this year. Through that step, the German government has committed to work with its partners to assist affected countries and regions as they address neglected tropical diseases. The One Health approach is especially important here. We finally have to address human, animal, and environmental health together, because everything on our planet is interrelated. Healthy life depends on a healthy planet. This is also why Germany has been supporting the Central African Economic and Monetary Community since 2017 with regard to the implementation of national NTD programs and with regard to NTD research. This year, the Development Ministry is providing another 18 million euros for this, with a special focus on strengthening the One Health approach. Since 2018, Germany has also made available about 75 million euro for the development of lab capacity and diagnostic systems in the ECOWAS region. And since 2019, it has provided some 6.8 million euros for WHO's Aspen program. Since the beginning of this year, my ministry has been supporting efforts by the World Organization for Animal Health to fight rabies in Namibia and Cameroon. We have provided 10 million euros to this. We are committed to the global 0 by 30 goal, which provides the ending human deaths from dog-mediated rabies by 2030. Ladies and gentlemen, dear colleagues, the pandemic has shown us how fragile our hard-won achievements are including on NTD control. Continuous and sustained support for NTD programs is therefore all the more important. In the 2030 agenda, we have promised to leave no one behind. Germany takes this promise very seriously. So let us all join hands to make the goals of the WHO roadmap for NTDs a reality for all people by 2030. Thank you very much.
Great. And finally, it's my honor to welcome to the stage Jonathan Kamen, who is USAID's Mission Director for Rwanda and Burundi. As many of you know, the US government's the world's largest funder of malaria and NTDs through the President's Malaria Initiative, its role in the Global Fund, and other funding streams led by USAID. And so, Jonathan, welcome you to the stage. Thank you.
Distinguished guests, all protocols observed. Midway, urakoze kutwakira. Good afternoon, and I'm honored to share the forum with the various esteemed speakers we have heard today. The COVID-19 pandemic has devastated communities across the globe and exacerbated challenges fighting many other diseases. However, amid that devastation, we have seen firsthand how U.S. government commitment and investments have strengthened our ability to respond to health threats, such as malaria and neglected tropical diseases. Let's discuss malaria for a moment. Our response is through the U.S. President Malaria Initiative, PMI, led by the U.S. Agency for International Development and implemented together with the U.S. Centers for Disease Control and Prevention. As the largest donor in the battle to end malaria, the U.S. has helped save more than 10.6 million lives and prevent 1.7 billion malaria infections in partner countries around the world. U.S. government funding for PMI has increased from $30 million in 2006 to $755 million in 2021. Every year, we renew our commitment, yet the threat from malaria continues. More than 95% of malaria deaths were in Africa, and the majority were children under 5 years of age. Across the globe, a child dies of malaria almost every minute. In the last year, PMI, with partner countries, protected more than 700 million people. We delivered insecticide-treated nets, we sprayed homes with long-lasting insecticides, and we also provided pregnant women with treatments to protect them and their unborn babies. We are collaborating on the delivery of the world's first malaria vaccine. We're expanding support for community health workers, which we all know are often the unsung heroes of healthcare systems around the world. Furthermore, global partnerships such as USAID's partnership with the Global Fund to fight AIDS, tuberculosis, and malaria are fast-tracking innovations on a global scale. At USAID, we eagerly anticipate the Global Fund 7th Replenishment Conference, which will be hosted, as you heard just now, which will be hosted by President Biden later this year. Through U.S. leadership, we can galvanize the international community to face difficult challenges and get the world back on track toward ending HIV, TB, and malaria while building resilient and sustainable health systems. Just eradicating malaria alone could save 11 million lives and unlock $2 trillion in economic benefits by 2040. Now let's discuss neglected tropical diseases. Since 2006, the U.S. government, through USAID and in collaboration with the CDC, has been a leader in the fight against NTDs. USAID has committed resources to more than 30 countries as they work to control and eliminate 5 of the most disabling, life-altering NTDs. Partnership with the private sector have made it possible for U.S. investments to have dramatically greater impact around the globe. Every $1 invested by the U.S. leverages $26 in donated medicines for treatment campaigns, totaling more than $28 billion in value to date. Our country partners have delivered nearly 3 billion treatments so far. To date, 10 USAID-supported countries have successfully eliminated one or more NTDs. And I'm pleased to share today that within 5 years, 15 additional USAID-supported countries are targeted to eliminate at least one NTD. I'm also pleased to share with you today that the U.S. has now signed the Kigali Declaration on NTDs. Strong national leadership is the key to securing NTD resources long-term, and that's why we are here today. USAID is working with countries to develop strategies that will ensure sustainable national services for NTDs. This is only possible through strengthened political commitment, engagement across multiple sectors, and the expansion of domestic investments. While challenges such as climate change, conflict, and insecticide resistance threaten to set back our hard-won progress against malaria and NTDs, the opportunities generated by our commitment and investments are helping us get closer to a world free from these diseases. We have the knowledge, we have the tools to end malaria and NTDs once and for all. And the U.S., along with global and country partners, must continue to accelerate the fight against malaria and NTDs. I thank you for your attention. Murakoze Chane, and I wish you a good conference today.
Murakoze Namwe. That was the USAID Mission Director for Rwanda and Burundi and the U.S. Embassy Chargé d'Affaires ad interim, Jonathan Kameen. Thank you so much for that promising commitment. I'm so pleased to now introduce our next panel, who are all members of the End Malaria Council. To introduce this formidable group of individuals to the chair of the is the chair of the Kenya End Malaria Council and Managing Director of SUCHEF Limited. Please welcome Mr. Chris Gitonga.
Distinguished guests and our implementing partners, good afternoon. My name is Chris Gitonga, and I'm the chair of the Kenya End Malaria Council. The End Malaria Councils and funds are innovative country-owned and country-led mechanisms for mobilizing advocacy, action, resources, and accountability to end malaria. They convene senior leaders from the government, the private sector, and civil society to close gaps in national malaria strategic plans and in partnership with the national malaria programs. End Malaria Councils and funds have been a priority of our President, His Excellency President Uhuru Kenyatta, the chair of the Africa Leaders Malaria Alliance. The End Malaria Councils and funds in the Kingdom of Eswatini and the Republics of Kenya, Mozambique, Uganda, and Zambia have mobilized more than $23 million to support the National Malaria Strategic Plan. And our ambitions continue to grow. Collectively, we aim to mobilize $100 million to close gaps and continue to recruit new multi-sectoral partners to end malaria. This target will certainly increase as another 19 countries across the region are working to establish councils and funds of their own. The EMCs help fulfill initiatives like Zero Malaria Starts With Me, Zero Malaria Business Leadership Initiatives, and the High Burden to High Impact. For example, EcoBank has pledged $600,000 to support the private sector mobilization and recently launched the ZMBLI in Uganda with its End Malaria Fund. As a business leader myself, I know that the private sector has many unique capabilities, experiences, and resources that can support the fight against malaria and the NTDs. In Kenya, the End Malaria Council recently signed a memorandum of understanding with family business called SC Johnson to provide resources and support for social and behavioral change, vector control, local manufacturing of malaria commodities. We look forward to building on this partnership and others across the sectors to achieve a malaria-free Kenya. Zero malaria and Nyanza na mimi. Thank you.
chairperson of the Eswatini End Malaria Fund. We were launched in May of 2019 by His Majesty King Mswati III when he was chairperson of ALMA. Now, because malaria doesn't know whether you're the king, whether you're the pregnant CEO, whether you're a cane worker or a child, we started off focused on advocacy. We've done a lot of work with the chiefs, done a lot of work with entities such as MTN for them to send out disease notification messages, give us data for free. We've also been working in vector control. So for example, we've been helping IRS spray insecticide, making sure they can reach wider coverage. We've been making sure that our youth also are involved, thanks to Kenya. We've also just heeded that call by their President Kenyatta, because what we worked out is that African countries were our brothers, each other's keepers. Unless we eliminate malaria in neighboring Mozambique and in South Africa, our neighbors, we're not going to be able to have a sustainable elimination in Eswatini. What do we commit to? We commit absolutely 100% to zero malaria in Eswatini. So in 1995, there were 9,700 cases of malaria, but last year there were just 400. But unfortunately for us as a nation, we also had 4 deaths. For us, that's 4 deaths too many because we want zero. We don't want a single death coming. We're really on the cusp of elimination in Eswatini. And entities such as the Global Fund that have given us resources have given us a lot of cash resource that we need in order to reach that zero from the 4 we're at now. We also in Eswatini just wanted to appeal to all of us here as human and corporate citizens to walk with us that last smile so we can all say as a continent, zero malaria starts with me. Neighbor Mozambique.
Good afternoon, everyone. Boa tarde. I'm Reverend Dr. Sida Jidenna. I'm the president of the Mozambique Council of Churches and the chair of the Fundo da Malaria. As a faith leader, we have an important role in mobilizing communities to control malaria. When houses of worship were closed because of COVID-19, the board of directors partnered with PIRCON, a civil society organization, to sustain the visibility of malaria and promote social and behavioral change communications. We recorded television and radio messages which were broadcast nationwide. The fund has also engaged more than 50 private sector companies and mobilized the initial pledge of more than 8 million USD. This year, we provided funding for communication and supported the indoor residual spraying campaign led by the National Malaria Control Program. We, the Fundo da Malaria, are committed to launching 4 provincial and malaria councils to mobilize community leaders and an initial target of mobilizing 15 million USD to close gaps in the national strategy. We are also committed to launching an emergency fund to mobilize resources to support internal displaced populations, such as those affected by cyclones and other national disasters. Zero malaria starts with me.
Good afternoon, everyone. My name is Constance Njogu. I'm the regional coordinator for Isdale Flowers Cross-Border Malaria Initiative and a member of the End Malaria Council in Zambia. Isdale Cross-Border Malaria Initiative has been supporting the faith-based malaria control and cross-border malaria initiatives in Zambia, as well as the neighboring countries across Southern Africa. As the End Malaria Council, we recognize the importance of the faith leaders and also mobilizing of the faith leaders to support the advocacy of malaria elimination, to mobilize financial resources, as well as social behavior change communication. As Isdale Flowers Cross-Border Malaria Initiative, we commit to continue supporting the malaria intervention in the cross-border areas. As the End Malaria Council, our target is to mobilize $43 million to support the construction of the health facility, the Universal Lean Campaign, indoor residual spraying, case management, mass drug administration, as well as any other areas where there are gaps in the National Strategic Plan. Malaria ends with me. Thank you.
Good afternoon. My name is Dr. Malaria Neglected. I'm head of Malaria and NTD program in Rwanda. It's a pleasure this afternoon to join you to share Rwanda perspective. Rwanda recognizes that financial gaps still exist in covering all malaria and NTD program need, despite current government of Rwanda and partners' effort to implement key malaria and NTD control interventions. Furthermore, it has been noted that addressing those two groups of diseases is beyond the only Ministry of Health, considering potential risk factors, but also multiple key stakeholders through various sectors that should be involved to address those diseases. With the current country effort to embrace One Health approach and guided by integration and sectoral collaboration, for Rwanda, we are rather designing an integrated disease control resource mobilization mechanism that will involve public, private sectors, as well as civil societies to ensure that joint resource mobilization effort and allocation are well coordinated from the advocacy and planning, but also through the implementation of evidence-based disease control interventions. Zero malaria starts with me, zero malaria starts with you. Thank you.
Once again to our panelists. We certainly all have a role to play in accelerating action and unblocking the potential of ending malaria and NTDs within a single generation so that future generations are not burdened by these diseases. And with thanks to political leadership and much needed funding, we have succeeded in saving and improving billions of lives for generations to come. But there's still lots more to do. To share their firm commitments and how they can continue to make a difference in these efforts are Goodbye Malaria CEO Sherwin Charles and the Director of Sustainable Business Strategy at Dentsu SSA. Welcome.
Good afternoon. In keeping with the last conversation, it's just right to say zero malaria starts with me. Thank you for the opportunity to allow us to announce our commitment to the fight against malaria eradication. As Goodbye Malaria, we're committing to the Global Fund in support of the 7th replenishment, $5.5 million. This would bring our commitment to the Global Fund since 2016 to $15 million. And I think for someone like Goodbye Malaria, in-country, domestic funding, to us it's a big achievement. So thank you to all of you who have supported us. I'm also happy to confirm that the Bill and Melinda Gates Foundation has matched our commitment 2-to-1 and will be increasing funding over and above that to $14 million. A big thank you to my co-founders, Robbie Brosen and Kim Lazarus, and to our partners, namely Nando's and Vodacom, for this continued support and driving us to zero malaria in Southern Africa. I also wish to mention our support for the Global Fund. The private sector is a critical element to us accelerating towards reaching our targets for 2030. The Global Fund has been instrumental in ensuring the worst-case predictions during the pandemic were averted. So I wish to further commit our fight for what counts. Thank you.
Absolutely. And I believe that was 5.5 million. Is anyone calculating all of the numbers that have been spoken of here? Because I think we have gotten to quite a big amount now. We have our next speaker. I did mention a different name before, so allow me to correct that. Right now, I'd like to join me in welcoming Dr. David Reddy, the CEO of Medicines for Malaria Venture.
Excellencies, ladies and gentlemen, it's a privilege to be here today. Just to briefly introduce MMV, we're an organization that was set up in 1999 to catalyze the discovery, development, and delivery of anti-malarial medications. So we work in partnership with malaria endemic countries, with the private sector industry, academia, and other partners. And over the last 2 decades, we've brought to market, as a partnership, 11 new anti-malarial products that have saved collectively almost 3 million lives to date. Now, we're a 3D organization, as I mentioned, focusing on that whole end-to-end gap. We're supported by a number of key donors, and look, I would just like to quickly give credit to, first of all, our government donors, the UK, Australia, US, Germany, Switzerland, Ireland, Netherlands, Korea, and Monaco, and the European Union. And also to the Gates Foundation, UNITAID, and GHIT, who have supported us over that time. We're privileged to be able to support African-led clinical consortia that have provided key clinical data for global use, for use in other malaria endemic environments. And also the discovery of a novel clinical candidate by an African-led consortia at the University of Cape Town. With the support of UNITAID and encouraged by the African Leaders Malaria Alliance, in 2019, we broadened our focus on geographic diversification to include product manufacturing, supporting African countries in pursuing greater autonomy in the supply of malaria medicines and enhancing equitable access and supply chain security for the region. The importance of this was underscored by the COVID-19 pandemic, where we saw significant inequities in the distribution of health commodities. Today, with the support of our board of directors, I publicly commit our organization to forging ahead with partnerships at the national and regional levels with the near-term goal of achieving WHO pre-qualification for 3 Africa-based manufacturers for medicines to prevent malaria, particularly in pregnant women and very young infants. These 3 manufacturers are from Commonwealth nations. And ultimately, we at MMV strongly endorse the vision of African manufacturers taking their rightful place on the stage of global suppliers, providing quality medicines for all. Thank you.
Thank you too. And right now, I'd like to take this moment to invite our next speaker to the stage, the Director of Sustainable Business Strategy at Dentsu, that's Ms. Roxanne Boys. Welcome. Are we back? Once again, Ms. Roxanne Boys.
Thank you so much. As one of the largest communication agencies in the world, we focus on a number of SDGs. And for the past 5 years, we've actually focused on health. And what we have realized is that if we are to achieve any of these ambitious goals that we've set across the 17 SDGs by 2030, we really have to mobilize mass behavior change on a very big scale, activating 3 key pillars of power, which is governments, corporates, and people. Essentially individuals, whether these individuals are governments, politicians, CEOs, managers, farmers, stay-at-home moms, or the youth. And for us, these are all individuals, right? And at Dentsu, we work with over 90 of the world's top 100 brands. And it's our job to understand and connect with these individuals every single day. It's what we do. And with the power of these data points, insights, media channels, and the overall spectrum, we really realize that we have a very large power within us to be a catalyst for mass-scale change around the world. And we have decided not to become spectators, but to really mobilize this catalyst that we are and recognize the opportunity, potential, responsibility, and privilege that we have as this mass communication agency to create very large-scale change. And so with that being said, we are incredibly committed to what we're saying now in terms of our positioning and our promise. And so I'm very proud to be able to stand here today in front of all of you and pledge $5 million towards the global malaria fight. And we do believe that through transformational communication and partnering with the governments, with the corporates, and with the people, and mobilizing the youth, mobilizing the public, this is really how we create mass-scale change, because you're all doing phenomenal work on the ground. And so communications can really give legs to what you're doing and help us progress not only to eradicating malaria by 2030 within this generation 100%, but also really progressing in terms of purposeful progress. So thank you very much.
Thank you. The Kigali Declaration on NTDs is a new high-level political declaration that will build on previous success against NTDs. The Kigali Declaration puts ownership of NTD programs, integration, and cross-sectoral collaboration front and center to ensure that these programs are sustainable in the long term. The Kigali Declaration provides the opportunity to mobilize the political will, community commitment, resources, and action needed to end unnecessary suffering from NTDs. Endemic countries are leading the way.
The Kigali Declaration on Neglected Tropical Diseases is an exciting new high-level commitment to end NTDs once and for all. It will mobilize the political will, community engagement, resources, and action needed to stop the suffering caused by these diseases. Developed with extensive input from stakeholders around the world, The declaration puts individuals, communities, and countries at the center of the response. Each signatory makes a unique and vital contribution towards ending NTDs. Collectively, these will translate into incredible progress being made. With countries leading the way, international targets are embraced and translated into national strategies, leading to impact and progress. The actions set out in this powerful declaration will help us achieve the target for NTDs in Sustainable Development Goal 3 and deliver against the World Health Organization's NTD roadmap. So on this day, at this time, at this very moment, we call upon our global leaders to show they are 100% committed to endorse the Kigali Declaration, to unlock the potential to end NTDs, to change the lives of billions of people globally, and to build a stronger, healthier, safer world.
On behalf of the government and the people of Malawi, I am happy to sign the Kigali Declaration on Neglected Tropical Diseases.
Fantastic. As previously mentioned, the Kigali Declaration on NTDs is being led by endemic countries. Countries like Malawi and those we saw in the video are ensuring we reach our goals to control, treat, and eliminate NTDs. Now to the Minister of Health for Malawi for more on how they're doing that and what's next. Please welcome the Honorable Kumbizi Kandondo Chiponda, the Minister of Health for Malawi.
Good afternoon, honorable dignitaries, distinguished participants, our partners, colleagues, and friends, my sincere thanks to the government of Rwanda and our partners at Uniting to Combat NTDs and roll back malaria for inviting me to speak at this landmark event. I'm honored to be standing here in front of you, representing affected countries at the launch of the Kigali Declaration on NTDs. The Kigali Declaration provides the opportunity to mobilize and unify the political will, community commitment, resources, and action needed to end NTDs. Near 13 million people in Malawi continue to be affected by neglected tropical diseases. However, we have made and continue to make great progress in the fight against NTDs, including the elimination of the lymphatic filariasis as a public health problem in the year 2020. This elimination success makes Malawi one of the only 3 countries in Africa to achieve this. Malawi is also on the threshold of eliminating trachoma as a public health problem. We see this pattern of success led by national programs of endemic countries to be repeated globally. We need concerted action if we are to achieve the ambitious targets set out by WHO in their NTD roadmap and in the Sustainable Development Goals. As a country, Malawi, we are 100% committed to reaching these goals and ending NTDs, which is what our state president has already said in the clip which you have just seen. I thank you so much. God bless you all.
Thank you, Honorable Minister. It's not just heads of state, CEOs, and philanthropists that can be leaders in ending malaria. People everywhere are showing that they are 100% committed to ending NTDs. People like Jidenna, a Grammy Award-nominated American-Nigerian musician who is raising his voice for the 1.7 billion people who are still affected by NTDs.
As a former teacher and education advocate, I saw firsthand the direct correlation between education and health. We can't educate children who are not healthy, and can't keep them healthy if they're not educated. NTDs prevents children from being able to go to school. So if governments are serious about getting the world's most vulnerable children into school, we must remove the barriers that prevent this. School health programs such as deworming are absolutely crucial. This is why ending neglected tropical diseases is something we should all make our business. I, Jidenna, am 100% committed to ending neglected tropical diseases once and for all, and I'm proud to be joining in this fight. I call on you, each and every one of you, to join the fight to end neglected tropical diseases and transform the lives of over 1.7 billion people on planet Earth. Peace, peace.
Hello, everyone. My name is Huria Miri. I am a youth advocate from Pakistan, and I am 100% committed to ending neglected tropical diseases. There are many global representatives like me. There are many global leaders like me, from heads of states to community champions and to global celebrities. We are using our platforms to advance the mission of a world free from neglected tropical diseases, and we'd like you to join us. Thank you.
Thank you. I'd like to mention anyone who is going to be attending Professor Ugur Sahin's session needs to go to the Gasabo room on the first floor right now, okay? As we move along, COVID-19 has further demonstrated the critical importance of investing in strong public health systems that can both respond to endemic diseases such as malaria and NTDs and build global resilience against pandemics and other health threats. Ending malaria and NTDs must be a key component of our long-term response to COVID-19 and future shocks. I'm so pleased, therefore, to once again introduce further commitments which will serve to unlock the potential of a world free from malaria and NTDs and ultimately transform the lives of billions.
On behalf of the United Kingdom, I'm pleased to sign the Kigali Declaration on Neglected Tropical Diseases. This declaration is a pivotal moment in our collective fight to end NTDs, and I'm proud that we have come together to reaffirm our historic commitments and endorse the World Health Organization's roadmap. It was 10 years ago the United Kingdom launched the London Declaration on NTDs. The progress since then really shows the extraordinary things we can achieve when we work together. In a decade, 43 countries have eliminated at least one NTD. Each year, for 5 years in a row, more than 1 billion people have benefited from treatments. But the reality is, NTDs still affect over 1 billion people globally. The burden often falls hardest on the world's poorest, on vulnerable groups such as women and girls, and its impact is felt across many Commonwealth nations. There is therefore no room for complacency if we are truly to end this epidemic. On our part, the United Kingdom will continue to fund research into new drugs and diagnostics for NTDs through product development partnerships and other research organizations. We will also continue to support countries to strengthen their health systems, to make sure the essential services for NTD prevention and treatment are accessible to all. This declaration is indeed that pivotal moment. And indeed, if we've learnt anything from the past 2 years, it is that only when we work together collaboratively across all sectors and across the whole of society will we truly end the suffering caused by NTDs. Today, we have a clear goal, and together with that goal, a clear call to action, which is why I, on behalf of my country, the United Kingdom, am signing this important declaration. And I would urge other partners and nations to do the same. Thank you.
Distinguished guests, please join me in welcoming Dr. Caroline Harper, the CEO of Sightsavers.
Thank you very much, and hi everybody. Thank you to the government of Rwanda and also to the fabulous uniting team who've made all this possible. So Sightsavers, we've been working in NTDs now since 1950, and in that time we've spent over $375 million, and we've delivered more than 1.5 billion treatments. And I'd like to give a big shout out to the community drug distributors, the volunteers, and the community health workers who made that possible. Thank you very much. And isn't it great that the UK have signed up to the Kigali Declaration? The UK have been such an important partner and donor for Sight Savers, and I really hope that this is the first step towards the UK becoming a leader again in NTDs. That would be so fabulous. So, Sight Savers, we are committing today to invest more than $25 million of new money into NTDs from now to 2025. This money has already been raised, mostly from the British public and from some major donors. This money is already in the bank and ready to go. And in 2025, when Sight Savers celebrates its 75th anniversary, we will make new commitments to NTDs. Just to be clear, this money is in addition to money that we receive from some really generous donors, some of which are here today, people like the Bill and Melinda Gates Foundation, SIF, Elmer and GiveWell. So this is additional money. And as part of this, we will set aside £5 million as a tribute to Her Majesty the Queen in this, her Platinum Jubilee year. And this money will go to the elimination of trachoma in the Commonwealth. This builds on the work that the Queen Elizabeth Diamond Jubilee Trust did and is part of the commitment that was made at the last CHOGM to eliminate trachoma. And what I fervently hope, and I'm looking now at the Honourable Minister of Health for Malawi, is that I hope we will be able to celebrate with the people of Malawi and with Her Majesty the Queen later on this year when we all eliminate trachoma in Malawi. Thank you all very much.
Excellencies, dear colleagues, and esteemed participants attending the Kigali Summit. I join you on behalf of Canada to sign the Kigali Declaration. We stand firmly behind the commitment to eliminate neglected tropical diseases by 2030 as part of our collective efforts to achieve the Sustainable Development Goals. Canada's commitment is to advocate for the integration of neglected tropical diseases when providing health services. We also need to ensure that primary health care takes a gender-based approach to reduce the impact of the diseases on women and girls. We have more to do, but by working together as part of this effort, we can save lives. Thank you. Merci beaucoup.
That was the Minister of International Development of Canada, Honourable Harjit Sajjan. Now, distinguished guests, please welcome Dr. Carol Karutu, Vice President of Programs at NFund.
Good afternoon, ladies and gentlemen. The NFund was founded in tandem with the 2012 London Declaration on NTDs and is the leading vehicle for private philanthropy in the NTD sector. The drug donations that you've heard about today have created incredible incentives to mobilize over $225 million to support NTD program delivery since our founding. I'd like to sincerely thank the pharmaceutical companies who have helped make this possible and continue to motivate philanthropists around the world to invest in NTD programming. At the same time, I'd like to sincerely thank the governments, and especially the African governments that we work with, for their critical and often understated and underappreciated contributions. The NFund has always considered any investment in tackling NTDs as a core investment with government. Even though government investments, such as human resources, supervision, infrastructure, are not always quantified, we recognize how crucial these are to the success of any NTD program and to the commitment of the NFund. Today, as we look towards NTD elimination by 2030, we are inspired by the Kigali Declaration and what it represents, and also by the demonstrations of the leadership that we see here today. For us to finally bring an end to these ancient diseases that continue to hold back our communities, we know that those most proximate to these challenges must drive our global agenda and our global efforts and solutions so that they are right for our local contexts. The End Fund is committed to support and galvanize even greater leadership from our local stakeholders, starting from governments, and down to the women who are disproportionately affected by NTDs and who, along with their children, represent the key to unlocking the potential of our communities and our economies. And today, the End Fund is proud to commit $161 million to invest with our government partners in pursuit of a world where all people have the opportunity to thrive and live prosperous lives. And that means a world without NTDs by 2030. Thank you.
Thank you. And with that, we have come to the end of this first part of today's Kigali Summit. This afternoon will continue as we introduce to you various key partners and the all-important heads of state program. This will be ably facilitated by my colleague, journalist, political show host, and news anchor, Ann Kiguta. I leave you in her capable hands. If you will be back in this room, you need to be here by 3:50. That is 10 minutes to hour, because the doors will be closing after that for the commencement, of course, of this all-important program. Please enjoy your comfort break, and from me, Makeda Mahadio, thank you very, very much, and have a great afternoon.
Thank you so much to the beautiful, thank you, unbelievable Makeda Mahadio, distinguished guests. As Makeda said, we kindly request that you now enjoy your short comfort break. Please do make sure that you're back in the venue at 10 to 4. That is at 3:50, distinguished guests. The doors will be closed, and you will not be allowed access into this venue if you have not taken your seats by 10 to 4. We'll see you back very shortly. Thank you very much.